Now we will see applied anatomy of median nerve. So the effects of injury to the median nerve is the injury to the median nerve vary depending upon the level of injury. Depending upon the level of injury. Level. So whatever may be. It may be at the axilla, it may be above the elbow joint, above the wrist joint, or in the forearm, like that. So at the level of injury, the effects being confined to structures supplied by these branches. Okay, distal to the injury. If injury is at this level, so above this level the nerve is normal, and below the level of injury all this nerve is affected, and the branches supplied by this are also affected. Okay, if it is above the level of elbow joint, now these branches are getting affected and this one is spared. And if you see at the wrist, at the level of wrist, all these are spared and these branches are affected. Okay. And now, depending upon the level of lesion and the branch involved, all or some of the effects can be seen. Okay. So if it is at this level, the entire nerve is getting injured and all the branches are affected. And if you take above the level of elbow and the branches which are supplying to the forearm and the hand is affected, and at the wrist if you can take, only the branches which are supplying to the hand are affected. So based upon the level of injury, we are having different types of clinical anatomy we are going to see now. So for example, if distal branches of the median nerve supply to the first and second lumbricals are paralyzed, so these muscles normally helps in the flexion of the metacarpophalangeal joints of the index and the middle fingers is lost. So what will happen then? So when a person is attempted to making a fist, the index and middle fingers remain in partial extension, leading to the position of benediction of the hand. That means మనం ఎప్పుడైనా కంప్లీట్ ఫిస్ట్గా ఫామ్ చేయాలనుకుంటే, హ్యాండ్ని టైట్ ఫిస్ట్గా ఫామ్ చేయాలనుకున్నప్పుడు ఏమవుతుంది అంటే, సో ద ఇండెక్స్ ఫింగర్ అండ్ ద మిడిల్ ఫింగర్ will not form a fist, and the remaining other fingers, the two fingers forming the fist. So this position leads to the position of benediction of the hand. Normally this benediction is that normally in religious blessing is there in Christianity, that is the position called as position of benediction of the hand, because of the distal two digital branches of the median nerve is affected, which is supplied to first and second lumbricals. This is one type. If we know that we are having here another important branch which is present deeply in the forearm, front of the forearm, that is the anterior interosseous nerve. If that nerve is affected, we'll get a syndrome called anterior interosseous nerve syndrome. So this muscle is supplied to deep muscles, I have told that is flexor pollicis longus. This is supplied to flexor pollicis longus, pronator quadratus, and a part of flexor digitorum profundus. Part of flexor digitorum profundus, that too giving tendons to the index and middle finger. Okay, these three muscles are affected in anterior interosseous nerve syndrome. If flexor pollicis longus is affected, that means there is a loss of flexion at the interphalangeal joints of the thumb. So there is a loss of flexion at the interphalangeal joints of the thumb. And if pronator quadratus is affected, there may be a loss in the pronation, weakness in the pronation is observed. And also, and the distal interphalangeal joints of index and middle finger is also affected if anterior interosseous nerve is affected. Okay, then such kind of condition normally described as a triangular sign. That means, so if you ask that person to touch the tips of the index finger and the thumb finger, that person is not able to do such function. So such kind of, so what will happen, the persons will not flex at the distal interphalangeal joints of the index finger as well as the thumb. So what will happen? So the person is going to flex at the metacarpophalangeal joints of the index finger to touch the tip of the thumb finger and leading to a triangular sign. So if it, for example, if you consider this one as thumb, so next one is the index finger, the person will flex like this at the metacarpophalangeal joints to touch the thumb, causing a triangular sign. Normally what will happen, so if the muscles are well innervated, then the person will touch like this. They will flex at the index finger. Okay, so this kind of position we can see if in the normal type. This is one is the abnormal type. So the person want to touch the tip of the thumb finger, so the person is flexing at the metacarpophalangeal joints of the index finger. He is not flexing at the distal interphalangeal joints. This is called as anterior interosseous nerve syndrome. Another one is the carpal tunnel syndrome. So you people already know that carpal tunnel syndrome, it is the impingement of the median nerve in the carpal tunnel, that is below the flexor retinaculum. So this may be due to inflammation of the synovial sheaths, normally the ulnar bursa, and obesity, and during pregnancy also this nerve entrapment can be seen. So what will happen? So if any injury at the level of wrist and also in the carpal tunnel syndrome also, so the muscles supplied to the thenar eminence is lost and leading to the ape thumb deformity. So what will happen? The thenar muscles are going to be wasted here and the thumb is adducted and laterally rotated, and opposition of thumb is totally lost. This is the another type of deformity seen in the median nerve, that is called ape thumb deformity. And also there is a sensory loss is seen in the lateral 3.5 fingers, on the palmar aspect. On the dorsal aspect, lateral 3.5 terminal phalanges doesn't have the sensory feeling. Okay, so this is about the applied anatomy of the median nerve. In the next videos, I'll show you the pics of each deformity and you can understand well. Okay.